I do a lot of Mohs surgery. And so I did not want this to become something that took away from my Mohs practice. I wanted to integrate it in to where I was still seeing my general derm patients, still seeing my follow-up Mohs patients, and still doing Mohs. And that's what we were able to do. So then the big question became, will patients actually pay for this? I really thought I'd see more resistance to people wanting to pay for this service. But then what happened was um, people know that when they go to the pharmacy, their deductibles are high, their copays are high, and they're going to get hit for $250, $300 a per time that they go to the pharmacy. Even with Accutane, even when it's approved by their insurance, it's going to be expensive. And if they're having to do labs every other month, then they have to pay for those labs and they have to pay for the monthly office visit. So several cycles of antibiotics can cost $1,500. If you go through an entire 6 to 8 month course of Retin-A, isotretinoin, it can cost that much money. So when you have that realistic conversation, then people understand that, hey, this is reasonable. So when I sit down with a patient, when they come in for acne, usually somebody's coming to me after they've already seen their family practice doctor. So they're not coming to me never having taken an antibiotic. They're not coming to me never having used a cream. They've done that. Now they're wanting something different. So I typically will say, do you have a personal objection, or do you have an objection for your child to taking antibiotics? If they say, yes, I do not like antibiotics, I want nothing to do with it, then I pretty much know that that person, if they can afford it, they are going to do the laser. And so I just say, okay, well, let's talk about our laser. Now I'm dealing with people that are already referred to me for the laser. So they're already ready to talk about it. If they say, no, I don't have any objection to antibiotics, that's kind of what we were thinking. Sometimes people will say that, no, we haven't really tried. We've done some creams, but we haven't really tried any antibiotics. Then I'll say, okay, let's discuss antibiotics, and we can talk about our laser treatment down the line. Oftentimes at that point, they'll say, well, tell me about the laser now also. And so then we can start the discussion of adding the laser on top of the antibiotics. And we really seem to have a positive response to that as well. So this is how we set up our fee schedule. If they're what I would call a 1 to 2 plus, where they've got some pustules, maybe a couple of cysts, and they've got some comedones, just the little flesh colored bumps, then I call that mild to moderate. And we're going to charge about $200 per session. If they're severe, and you can picture it in your head right now on your own, they've got many, many pustules, they've got the nodulocystic, they've got scarring, then we're probably going to have to charge $250 a session because that's going to take some time for my tech to be able to really get in on top of all of those. And that's for the face. Now we do have people that ask about chest and back, and pretty much we then add on about $150 for the chest and $150 for the back. And yes, that can get expensive. And the amazing thing to us is that people then often will say, okay, that's what I want to do. And then what we do, we don't make people pay up front. I don't want to say you have to pay $1,500 now up front. I tell them you're committing to paying probably $1,200 to $1,500 for this, so that they know that's what it's going to take to eventually get to where they want to go. But I do not sell it like a package deal where they have to pay up front. That's just not my style. I just want them to be able to pay as they come. And as I've said before, I don't want to be I don't want to feel like I'm selling to people. I just want to let people know that we have something that most people don't have, but that their insurance doesn't cover it. To me, this has been an absolute no-brainer addition to my practice. I think it's from a revenue standpoint, it's been tremendously successful. I want to get into that real quick. As I said before, I split, I didn't mention this, but I split my laser with one of my partners. And so we put it on a 5-year payment at the bank with a nice low interest rate. And my break even to make my payment every month was 3 acne cases, okay, or three cases period at $250 a piece. And keep in mind now, there are no products that you have to use every time. There's no tips. You don't have to use cooling gels. So I'm not spending money every time the laser is turned on. So my break even was 3 cases a month. My first month, we did close to 20 cases. So you can run the math on that. That is a great return on investment. Then we've had months where we've done 45 or 50 cases in a month. So again, when you're talking about a laser payment that can be covered in 3 or 4 treatments, when we're doing 40 or 50 at times, that's an excellent return. And like I said earlier, I could be doing way more than that. We've seen an incredible bump in revenue from this. We've seen less paperwork, less hassle, less prior authorizations, less calls from pharmacies, and we're able to really differentiate ourselves from what other people are doing in town. And it's really neat for me as a doc to be able to say that I do something that nobody else is doing. And here at the bottom, obviously, when we do laser, the profit goes to me instead of the profit going to a drug company. So that's nice. I don't mind that. I visited with Dr. Gold at Vanderbilt and just got his pricing structure. And then I talked to Monica. And then I really looked at what I knew that patients were spending on a full treatment of Accutane or several rounds of antibiotics. And I kind of came to the number of $1,500 is what people are going to spend between multiple copays, lab copays, pharmaceutical copays, et cetera. And so I just felt like that's a reasonable investment. I know that I've got a friend that runs a laser hair removal clinic, and I know that people pay thousands of dollars to have their hair removed. And so I just felt like a $1,500 investment to get your face clear or your child's face clear was reasonable, but it wasn't cost prohibitive because I want this to be available to as many people as possible. I don't want it to be only for the rich people in my town. And so I wanted it to be something that working class people could handle, and even students. So, and by students, I mean college students or people that are working their way through school or waiting tables or whatever they may be doing. I wanted them to be able to afford it also.